As vaccinations continue, experts are talking about whether people who have had COVID have enough protection without getting a shot.
And we know part of the answer. It does give some protection, but how much and how long is still unclear. Alan Janae looked at the debate going on in the research community for us, joins us tonight. So, Alan, any answers?
Well, jury's still out on this one. Two studies, one in Israel and another here in the United States, showed that prior infection was effective in preventing many COVID infections. But there are a lot of ifs in these studies. And while there is a lot of discussion going on, for now, the recommendations are not changing. Roy Trujillo is back for another shot.
So this is a booster for you?
Yes.
So you're glad to get that?
Oh, yeah, get it out of the way.
Trujillo, his wife, and two grandchildren all got COVID last year before the vaccines were out.
Do you think you gained any protection from that case?
I think I did.
And he might have. But how much is a big question, and for how long?
So it's not saying that people with infections don't get that, but the vaccine can do it reliably.
The Cleveland Clinic that did the U.S. study has also released a follow-up to its findings, noting the people who went unvaccinated were likely younger and healthier than those who sought vaccination.
If you were early on in the pandemic getting vaccinated in December and January, you're likely a healthcare worker, older, compromised, being very careful. That's somebody that's more likely to get a breakthrough infection.
The immune system, notes National Jewish Health's Dr. David Buther, has the first responders, the antibodies.
And they're your kind of beat cops out in the street looking for the perpetrator. They have a picture of the bad guy, and they're out there looking for him, circulating around.
And the second responders, memory in the cells that make more antibodies if an infection comes around again.
The T cell is really, I guess, the FBI database of criminals. It's there to keep a log of everything you've been exposed to in the past.
Roy hasn't gotten infected again and is glad he's sticking with it.
So has it worked for you?
I think it did, yeah.
Now, that secondary immune response, those T cells, was tested in the mRNA vaccines, which for vaccines in the past, by the way, wasn't the case. They just counted antibodies. Now, the protection from previous infection, Dr. Buther says, might be less in people who had mild infections, or those who had very severe infections may have immune response compromised. It's just not clear yet how many beat cops and how many FBI agents would be on your side, which is why there's still a recommendation that you get vaccinated.